But today we are starting with the latest on COVID-19. The state of New York has seen an 86% drop in coronavirus cases since January 7th. That's when more than 90,000 infections were reported. The drop is similar to what we saw in South Africa and the UK, where Omicron first took hold. Still, deaths and hospitalizations in New York remain elevated. Meanwhile, the state is appealing a judge's ruling that its mask mandate is unconstitutional as schools and businesses make plans to review mask mandates in the coming week. So here now to discuss is Dr. Amesh Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Dr. Adalja, thanks as always for being here. So we just outlined some of the numbers right now. Omicron cases are less severe, but deaths are going up. I mean, how would you assess where we're at in the pandemic right now?
I think it's unclear, and the whole country is not on the exact same time frame. But in places that got hit with Omicron first, we are seeing a precipitous decline in cases, which was expected if you looked at the South African data, that Omicron tends to go through weeks-long cycles, and then maybe based on social network effects, it collapses. However, hospitalizations and deaths lag, so it's going to take some time to see hospitals decant the patients that are there. We are seeing less severity in the hospital, but there are some patients there that are there, remnants from the prior Delta wave. And if you're high risk, unvaccinated, Omicron is still sufficiently severe enough to land you in the hospital in many cases. So it's going to be some time before we get through this issue with hospital capacity. But I think things are looking better at this point, and hopefully this trend continues, and we still continue to get more rapid tests, antivirals, monoclonal antibodies, and vaccines into people.
And when you say things are getting better, we heard from Dr. Fauci, who said that the virus isn't going to be eradicated. And so then when will we know that we're sort of in this endemic time period that you've talked about a few times before? I mean, how far off are we? Is it the summer? Is it the spring?
I think that after this Omicron wave, we'll be well on to our way towards endemicity. To me, the big signal that would be that you don't see hospitals worrying about capacity. So right now, in certain regions of the country, hospitals are still stressed, trying to take care of COVID in the midst of staffing crises, as well as taking care of all the other health problems in their community. When we don't see that pressure on hospitals, I think that would be really the final stage of this pandemic moving into endemicity.
Considering that, then, are some of the restrictions easing outside of the U.S., are they too premature, would you say?
No, I don't think it's premature because we have vaccines that are basically universally available in the developed world for anybody above the age of 5 years of age. We've got booster vaccinations for high-risk people. We've got monoclonal antibodies, antivirals, more of those, their supply on the way, rapid tests. And I think we've got a lot more learning about risk calculation and understanding what risks are high, which risks are low. We've got non-pharmaceutical interventions like masks that people can choose to wear. So no, I think we have to come up with a sustainable approach that recognizes that we have to move out of this acute phase of emergency and teach people how to live in a world in which COVID-19 is ever present, but a tamer COVID-19. Because if you're fully vaccinated, this is not a serious infection. It's akin to influenza or the common cold for fully vaccinated individuals. And we've got to get people to start to realize that and actually follow the science, that if you're fully vaccinated, the virus is going to treat you very differently.
So then, Dr. Adalja, considering that, I mean, I've heard from a lot of people, some people who are fully vaccinated, gotten their booster, also gotten Omicron. I mean, how should they be, when you talk about risk calculations, what should they be doing? How should they be, moving about the world at this point in time? I mean, would you say the pandemic is over for them, or should they still be cautious?
And for all intents and purposes, the pandemic is over for anybody that's fully vaccinated, almost anybody except for the extremely high risk immunocompromised, because they're going to get an inevitable COVID infection, especially with Omicron, and it's going to be mild, similar to common colds that they get. And I think that's a win. So I think if you're fully vaccinated, and clearly if you're fully vaccinated and boosted or already had an Omicron breakthrough, you should be going about your life as best as you can, that this is not something that's a danger to you any longer. And I think that you have to start to realize that because COVID-19 is going to be ever present, this is the best we're going to get in terms of respiratory protection. And I think most people are not going to really or shouldn't worry so much about a mild illness that doesn't even cause them to call their doctor. And I think we've got to get people to understand that if you're protected, you should go about your life as much as your risk tolerance indicates, but you should have a pretty high risk tolerance because if you're following the science, vaccinated people, vaccinated boosted people, people with hybrid immunity, they really have nothing to fear from this virus.
But it's a different story, though, from people who maybe have young kids who cannot get vaccinated, right? Or they're around people who maybe have pre-existing conditions, right? I mean, they can't be thinking in that way at this point.
Well, I think that so for children, tend to be spared from the severe consequences of disease. And the best way to protect children that are too young to be vaccinated is to surround them with other vaccinated individuals. And I think that we will have vaccines for children, but in those situations, that illness is mild and there are other tools, specifically vaccinating everybody around them. For the immunocompromised, this is no different than for any other respiratory virus. They always have to be more vigilant. So for immunocompromised people, we vaccinate them, we boost them, we give them drugs like AstraZeneca's Evishield, which is a monoclonal antibody as a pre-exposure prophylaxis. We have antivirals as well, like Paxlovid. So there are systems in place to make sure that the immunocompromised do well. But immunocompromised people, and I take care of immunocompromised people, you have to tell them every flu season, be very careful who you're around. Think about wearing masks in high-risk situations. And that's going to continue to be the case for immunocompromised people.
Do you think Omicron going forward is going to be more of a concern than flu? I mean, I know when you look at the death count, more people are dying from COVID and I believe Delta or Omicron cases than the flu at this point in time. Is that a concern sort of when you look at next year and the rest of winter?
It's going to take some time for COVID-19 to kind of settle down to a flu-like pattern in terms of deaths. But remember, flu kills sometimes 30,000 people a year, and bad years, 80,000 people a year. So I think that COVID-19 is going to settle into that type of a number. Although we have better tools for COVID-19, better vaccines, better antivirals than we could even dream of for influenza. So that may tame it. But it is going to be some time before it gets to that level. It's also important to remember that a lot of the deaths that we're still seeing are from infections in the Delta era. So Delta is still killing people because people don't die immediately when they get COVID-19. They often have prolonged hospital courses. So earlier, at least a couple of weeks ago, the CDC had produced data showing that most of the hospitalizations and deaths they were enriched for Delta because Delta is a more severe variant. But it will be the case that this is going to have a bigger toll than influenza until more immunity is in the population and we have more tools. But the thing is, with COVID-19, every death, every hospitalization is basically vaccine preventable. That's not the case with influenza because our vaccines aren't as good. So what's happening is people are choosing not to be vaccinated and choosing to take that risk upon themselves to be hospitalized and to die from COVID-19, which is very different than influenza.
That's true.
These are self-inflicted.
Yeah, and we know the numbers still of the unvaccinated are pretty high, at least here in the States.